Question 241. Which of the following statements by an adult child of a client with late-stage Alzheimer's disease indicates a need for further teaching by the nurse? A. I should provide a regular schedule for toileting. B. I should talk to my father less because he can't communicate. C. I should give my father oral care after every meal and bedtime. D. I should assist my father with eating and drinking. Answer B. Explanation. Even though an Alzheimer's client might not be able to talk or communicate his needs, the family should still communicate through talking and touching. The other statements are correct and indicate adequate understanding, reduction of risk potential. Question 242. Regardless of their practice area, nurses should be concerned with A. All drug-resistant bacteria. B. Microorganisms that are critical. C. Transmission of microorganisms. D. Overprescription of bacteriostatic drugs. Answer C. Explanation. All nurses should be concerned with preventing the transmission of microorganisms to themselves as well as to others. One way to accomplish this goal is by asepsis. Nursing practice focuses on providing a safe and therapeutic environment to protect clients, family members, and healthcare providers from acquiring infections, safety and infection control. Question 243. A hospital discharge planning nurse is making arrangements for a client who has an epidural catheter for continuous infusion of opioids to be placed in a long-term care facility. The family prefers a facility in its neighborhood to facilitate visiting. The neighborhood facility has never cared for a client with this type of need. What is the most appropriate action by the discharge planning nurse? A. Arrange for immediate in-services for a long-term care facility, staff on pain management using epidural catheters. B. Explain the situation to the client and family and seek another long-term care facility for discharge from the hospital. C. Encourage the family to hire private duty nurses skilled in epidural catheter pain management to allow the client to be transferred to the neighborhood facility. Answer C. Explanation. Safety demands that a client be transferred to a facility that can deliver care equal to the hospital, basic care and comfort. Question 244. The test used to differentiate sickle cell trait from sickle cell disease is A. Sickle cell preparation. B. Peripheral smell. C. Sickledex. D. Hemoglobin electrophoresis. Answer D. Explanation. Hemoglobin electrophoresis is used to differentiate between sickle cell trait and sickle cell disease. Physiological adaptation. Question 245. An effective intervention for clients diagnosed with obsessive-compulsive disorder is A. Discussing the repetitive action. B. Insisting the client not to perform the repetitive act. C. Informing the client that the act is not necessary. D. Encouraging daily exercise. Answer D. Explanation. Obsessive-compulsive disorder is an anxiety disorder. Exercise releases emotional energy, limits time for the maladaptive behavior, and directs the client's attention outward. Initially, nurses should not interfere with performance of the repetitive act, try reasoning the client out of the behavior, or ridicule the behavior. Psychosocial integrity. Question 246. Which of the following strategies should the nurse include when planning care for children of migrant workers? A. Delay immunization because of acute illness. B. Provide parents with copies of medical records. C. Schedule preventive services at acute illness visits. D. Stress the importance of using one primary care provider. Answer B. Explanation. Migrant workers should be provided with medical records and immunization records for their children, including growth charts. The parents should also be encouraged to take those records with them to every healthcare visit, including emergency department visits. It is important to provide immunizations even when the child is there for an acute illness because preventive care is often not obtained. Preventive services should also be provided, not scheduled, when a child presents for an acute illness. Using a single primary care provider is not an option for most migrant families. The nurse should ask the parents about where they are going next and give them the name, address, and phone numbers of providers there, health promotion, and maintenance. Question 247. When caring for a client with a possible diagnosis of placenta previa, which of the following admission procedures should the nurse omit? A. Perineal shave. B. Enema. C. Urine specimen collection. D. Blood specimen collection. Answer B. Explanation. An enema could dislodge the placenta and increase bleeding. Physiological adaptation. Question 248. Which of the following is true concerning human immunodeficiency virus HIV? A. HIV infection involves CD4 receptor protein on the surface of helper T cells. B. The presence of circulating antibodies that neutralize HIV is evidence that the individual has immunity HIV. C. HIV replication occurs extracircularly. D. DNA replication. Answer A. Explanation. The virus makes a DNA copy of its own RNA using the reverse transcriptase enzyme, and the DNA copy is inserted into the genetic material of the infected cell. Physiological adaptation. Question 249. The client with Parkinson's disease has difficulty performing voluntary movements. This is known as A. Akinesia, B. Dyskinesia, C. chorea, D. dystonia. Answer B. Explanation. Dyskinesia is an impairment of the ability to execute voluntary muscles. Physiological adaptation. Question 250. Appropriate nursing strategies to assist a client in maintaining a sense of self include A. Using the client's first name when addressing the client. B. Treating the client with dignity. C. Explaining procedures only if the client is attentive. D. Discouraging the use of personal items. Answer B. Explanation. All clients must be treated with dignity rather than a strategy. Treating clients with dignity is a basic core value universal to nursing, psychosocial integrity. Thank you for watching.